Philadelphia has filed in an effort to respond to the gravest public health crisis of our time, as you all know, the opioid epidemic. Earlier today, in the Philadelphia Court of Common Pleas, the city sued the following defendants, who are all manufacturers of prescription opioids: Allergan activists, Cephalon and Teva, Endo, Janssen and Johnson, and Purdue. As you all know, the city is currently in the grips of what can only be termed as a public health nightmare. This epidemic can be traced back to the defendants' false and deceptive marketing to doctors and to the public that these drugs were safe and effective for long-term daily treatment of chronic pain. So we are filing the lawsuit to do a couple things. We want the defendants to end their ongoing deceptive marketing practices, to communicate clearly to the doctors and to the public just how risky these drugs are, to pay for the treatment of city residents suffering from opioid addiction and consequences of inappropriate opioid use, and to pay the costs that the city has incurred in responding to this epidemic. The complaint is exhaustive and it's available here, and took a substantial amount of time and resources to prepare, reflecting the tremendous effort our team has undertaken over the last year. In over 160 pages, it tells the lengthy history of how the defendants engaged in deceptive marketing of these drugs. The complaint is replete with examples of these practices, and let me share with you just one. Defendants distorted a 1980 letter to the New England Journal of Medicine, citing it as the sole, quote, scientific support that opioids were safe and not addictive, and referring to that letter as if it was an article presenting a peer-reviewed study. It was not. Defendants also fostered and handsomely rewarded a range of physicians as, quote, key opinion leaders, and used front groups who claimed that addiction to prescription opioids is, and I quote, distinctively uncommon. The complaint also describes how defendants use the concept of, quote, pseudo-addiction, the idea that addictive behaviors should be seen not as warnings of addiction, but allegedly undertreated pain, to promote prescription opioid sales. The defendants' deceptive practices, marketing practices, has resulted in an exponential rise in prescription opioid sales in the city of Philadelphia. This epidemic has taken a grim toll in our city and includes historically high rates of opioid use and addiction and of opioid-related overdoses. The city's public health emergency is well documented and includes among the following: historically high incidence of babies born addicted to opioids. We've seen the number of babies born with these conditions in the city more than triple since 2002. Unprecedented increases in new hepatitis C infections, and sharp increases in the level of opioid-related emergency room visits and hospitalizations. This public health crisis has harmed public safety, order, and seriously disturbed the quality of life for all Philadelphia residents. And it's reflected by the fact that Philadelphia has the highest rate of opioid-related overdose deaths among the largest cities in the United States. City agencies have incurred tremendous and avoidable costs trying to combat this crisis. And because it is our duty to protect the public from further harm, I believe we have no other choice but to file this lawsuit. And I am confident that this lawsuit will be part of the larger process of reversing this tide. And I want to stress something, that this lawsuit is not intended to demonize the healthcare industry or pharmaceutical companies. And I want to make that absolutely clear. But our duty as lawyers is to follow the facts and see if there's been any violations of law. And here they have. And it's clear that the defendants' false marketing helped fuel this crisis. Before I conclude, I'll make people uncomfortable. There's a lot of lawyers in here, and I want to sort of thank the legal team that helped put this together. We're fortunate to have some of the best firms and attorneys working on this case. And I want to express my gratitude to the team from Berger and Montague, Scheller PC, Dilworth and Paxson, Sachs, Weston, Diamond, Young, Riccioliti, Caldwell and Heller, and Professor David Karras. This group has worked tirelessly to get the city to this point and really tell Philadelphia's story in this lawsuit. Next, I will turn to the city's health commissioner, Dr. Thomas Farley, to talk more about the effects of the opioid crisis in the city. He'll be followed by Commissioner David T. Jones of the Department of Behavioral Health and Intellectual Disability Services. And after we've concluded our remarks, we'll give an opportunity to answer any questions you may have. Dr. Farley?
Thank you. As you've just heard, we are in the middle of a public health crisis here in Philadelphia. And the city is doing everything it can to combat this crisis. But we think it is time that the companies who brought us here to help do their share to solve this problem. To give you just a sense of the magnitude of the problem, in 2017, when all the numbers are compiled, we expect that we will have approximately 1,200 people who will have died of a drug overdose in the city of Philadelphia. To put that in perspective, at the peak of the AIDS epidemic in this city, in 1994, the number of people who died from AIDS in a single year was 935. So in 2017, we will have surpassed the AIDS epidemic as far as the number of people who died in a single year. Of the drug overdoses that are occurring in Philadelphia, about 80% involve opioids, including prescription opioids, heroin, and fentanyl. Even those people, though, who are dying from heroin and fentanyl, for the most part, began their addiction by using prescription opioids. Now, Philadelphia has always had a heroin problem, but what's new here is that there's been a huge increase in prescribing of opioids that has occurred in the city since the 1990s. In fact, between 2001 and 2012 in Philadelphia, prescribing of these drugs doubled. And that has led to unprecedented use of these drugs. We conducted a survey in 2017 and found that 1 in 3 adults in the city of Philadelphia, or an estimated 469,000, had used a prescription painkiller in the past 12 months. And 1 in 7, or an estimated 168,000, were taking opioids at the time of the survey. Now, there's a legitimate use for prescription opioids in medical care, but nothing can justify this flood of prescribing of these drugs. The city is doing many things to try to combat this crisis. We're working with doctors and health systems and insurance companies to reduce the overprescribing. The Department of Behavioral Health and Intellectual Disability Services, as you'll hear more about in a minute, is working hard to increase access to high-quality drug treatment for those who already are addicted. Jointly, we have distributed with partners more than 20,000 doses of naloxone, the antidote to opioid overdose, across the city. At the city's jail system, we are offering drug treatment, and we are providing inmates naloxone doses to take home with them at the time of release. And this ultimately will solve this problem, but ultimately it will take many years and cost us many millions of dollars. To fix this, everyone needs to do his part, especially the drug companies that got us here in the first place. Because the surge in opioid sales and the tragedy of addiction and overdose didn't just happen. It was driven by the deceptive and aggressive marketing of companies that make money selling these drugs. They systematically misled doctors, telling them that these drugs were effective for chronic pain. They are not. They told doctors that they were safe and that they were not addictive. In fact, these drugs are risky, and they are highly addictive. They told doctors even, as you heard earlier, that if a patient shows symptoms of withdrawal, this is what they called pseudo-addiction, and they recommended that doctors give that patient even more opioids, which only serve to increase the addiction. And most upsetting, today, companies are still spending tens of millions of dollars trying to get doctors to prescribe more of these drugs. In fact, as the crisis has unfolded in this country between 2000 and 2014, the dollars spent on marketing these drugs has increased. And the sales in Philadelphia of these prescription opioids is still far higher than it was in the 1990s. So today we're asking the companies that sell these drugs to stop pushing these drugs in Philadelphia and to start helping us clean up the problems they have caused. That means, among other steps, communicating clearly to doctors just how risky these drugs are, educating the public that these are unsafe and addictive drugs, helping pay for treatment, and distributing naloxone to prevent people from dying of a drug overdose. None of this is going to bring back the thousands of people who have already died of a drug overdose in Philadelphia, but it will help prevent others from experiencing the same tragedy. Here in the city government, we are fighting this crisis, and we're in it for the long haul. We will combat the problem, and we will win. But we need the help of everyone, especially the drug companies that help fuel the crisis. Now I want to turn it over to Commissioner Jones from the Department of Behavioral Health and Intellectual Disability Services.
Good morning. As you've heard from Dr. Farley, the opioid crisis is ravaging communities throughout the city of Philadelphia. last year, the Department of Behavioral Health and Intellectual Disability Services worked with other city agencies to prepare and implement recommendations to address the growing opioid crisis in Philadelphia. And while unfortunately, again, as you've heard, the number of opioid-related deaths increased from 2016 to 2017, we are prepared to act adequately to address this problem. As the commissioners have pointed out, a problem that has been exacerbated by some pharmaceutical manufacturers overproducing and distributing opioids. As we work together to reduce the devastating loss of life this epidemic is causing, we know that mental illness and addiction are diseases of the brain and simply are not moral failures. In an effort to increase treatment access for people combating these diseases, we continue to increase access to treatment through expanding our coordinated response to addiction by facilitating treatment, or CRAFT. CRAFT has increased access to real-time assessments and referral to treatment. We're ensuring that people have access to medication-assisted treatment, both in the community as well as during under a more extreme circumstances during periods of incarceration. We have approximately 9,000 medication-assisted treatment slots, of which we're at about 75% capacity currently. We've expanded the network of people with lived experience or of people who are certified recovery specialists to help others gain access to treatment. There have been more than 800 warm handoffs to behavioral health care facilities. As you also heard, we're training providers, community stakeholders, and family members in naloxone administration, again, the antidote to reverse the effect of opioid-related overdoses. DBHIDS has supported the provider network in expanding access to treatment in the form of mobile treatment to take services directly to individuals in need who are not ready or able to access the array of community-based treatments available. We also are helping individuals obtain their identification cards so that they're able to access medication-assisted treatment. We've created a bilingual homeless outreach team to specifically target individuals who are not just dealing with substance use disorder, but also experiencing homelessness. In all, we've engaged more than 3,000 individuals in and around the Kensington community, but we realize this issue has an impact on not just the Kensington community, but the city of Philadelphia at large. As mentioned, we are continuing to provide treatment behind the prison walls, taking services and supports to individuals who are coping with substance use while spending time in prison. These services are not just to help men and women get the treatment to begin their recovery process, but more importantly, to help them remain in recovery once they are released. Such support can yield powerful results in keeping these individuals healthy, lessening the likelihood of recidivism, and keeping our communities safer. As you heard again from Dr. Farley, this issue did not happen overnight, nor will it be resolved overnight. There remains a great deal of work to be done to bring the numbers of those who are using as well as dying down, but we have done a lot to start what we fully believe will be a positive step in the right direction and changing the opioid distribution patterns of some pharmaceutical companies will eventually help save lives. Thank you. We'll take questions now.
Before we take questions, I just want to acknowledge Councilman Dom, who's here, and District Attorney Krasner was here earlier, and also Representative Jean DiGirolamo, who's the chair of the House Human Services Committee, who's there in the back. And with that, take some questions. Yes, sir. Yeah, you mean in terms of the overdose deaths or in terms of the litigation? Litigation, I mean, one of the things that I focused on when I came in is to reach out to other cities and see where they are. Chicago filed a lawsuit a few years ago, but I think we're one of the first big cities. I mean, there are Indianapolis, there's Seattle, there's New York who filed lawsuits. But the distinction between us and a lot of these other cities is that we've been hardest hit of any big city. I think we have the fourth highest rate, and certainly the highest rate of all big cities. And so it's something that was clearly, it was a focus. And what we did was really just start investigating what possible claims we may have, and also working with the folks here and some people who are not here, and looking factually whether or not there is a claim. Just because there is a crisis, there's a problem, it doesn't mean that you can sue. So it really took us a substantial amount of time to prepare the complaint, and also to put ourselves in a position where we can actually prevail. Yes, sir.
Estimate of the costs and treatment and city services that the city is looking to recover at this point, and also I assume the firms are working on a contingency basis. Can you talk about that arrangement?
Yeah, I mean, I can, and Dr. Farley can talk a little about some of the, it's in the millions in terms of the, and when we're talking about the cost to city, we're not just talking about the, EMS and police and all the additional resources we've had to focus on this effort. We're also talking about the city's role as an employer, and many of our employees who've been addicted to opioids, and that required us to pay more. And in terms of the fee arrangement, this is contingent fee, which means that, if the city doesn't recover a dime, these attorneys do not get paid. And it also means that they have to put forth a lot of their expertise and a lot of their resources up front, right? And this will be a significant litigation, and they're taking significant risk. But from the city's perspective, we're also looking at potential injunctive relief, right? It's not simply just bringing money into the city's coffers. It's trying to stop some of these practices, as Dr. Farley mentioned. They're going on to this day. And, and we can do all this work that we want, but at the end of the day, if the practice is still ongoing, we're still going to have people who are going to the direction of getting addicted. I already had you, so I'm going to get back to yes, ma'am. I mean, you're right, it's not a copycat lawsuit in terms of, one thing we made clear is that we'll listen to anybody. If anyone has an idea to help us move forward, we'll do so. And in fact, some of these have forced them to work together because they understand the public good here involved. And one of the differences is that we made this lawsuit about Philadelphia, right? It's not simply there's an opioid problem, we have to do something. We really were able to articulate how this has harmed Philadelphia, how this has hit all Philadelphians, irrespective of your race, your gender, what zip code you live in. And so we want to tell our story and also rely on the legal resources we have. This is in state court. We have a consumer protection claim, a public nuisance claim, and we're relying on a false claims ordinance, which is specific to Philadelphia. Not yet, not yet. It's something that we're considering, but we haven't asked for it yet.
What would you ask when you file? What is it you think you need them to stop right now?
We need them to stop claiming that these drugs are necessary for long-term chronic illnesses. It's clear that they're not.
Why not file with that?
There are legal reasons that, there are legal reasons that I'm not going to get into now, but, we're considering everything, but we haven't filed for one now. Yes, Pat. No, we don't have an estimate. I mean, we'll develop some of that as the case goes forward, but we can tell you it's substantial and it's in the millions. But I'm not going to tie myself to any number. Yes, you guys should have questions for them too, by the way. Okay, all right. No, I'm sorry. Yes. York and some other ones. I'm sorry, I didn't hear the last. No, we're not. I mean, we talked to some people, but we're not coordinating with them in that way because we also think that our claims are really about, for instance, the false claims ordinance is a Philadelphia-specific claim that we want to be able to bring. And I think that our theory, we talk about public nuisance and the cost that we've incurred, particularly as an employer, so that we have these health plans, that's fairly specific to Philadelphia. And it doesn't mean that their claims are less viable or more viable. It just means that we don't want to fall into people thinking that there's a problem, we're just going to file a complaint like everybody else. We really want to talk about the local problems because the relief we're seeking really ties to what's happening here in Philadelphia.
Speak to the contingency fees. What will these number of law firms receive percentage-wise if the city gets a lump sum in its plan?
It would be, I don't have an exact number. The general practice is about a third, generally, about 33%. And you guys can look at me and say, higher or lower. But that's generally, and that's the arrangement that we've in other cases as well. Because the key is that this is not a case that the city of Philadelphia can bring on its own. And we need the expertise and then the resources. And if you ask any of these lawyers, these are some of the best lawyers in the city of Philadelphia.
I have a question for Dr. Farley real quick.
Okay.
Sir, you're talking about naloxone, Narcan, all that kind of stuff versus, I'm going to ask it based on the way I asked it, but do you see that as a problem? And the reason I asked is because we've spoken to addicts before who just say, oh, I'm just going to get a hit of that and be brought back, no problem. That's my safety net, that's my safety cushion. Obviously it helps, but have you seen an uptick since that has been on the market with overdoses?
Yeah, and this is a question that people have raised periodically. There's no evidence that making naloxone available makes people who are using drugs take greater risks. People use drugs to deal with their withdrawal symptoms and to get the high from it. And if we have naloxone out there, we can prevent them from dying. But there's no concern that by putting naloxone out there, it's going to in any way hurt the problem or make it worse.
Dr. Farley, how close is the city to setting up sheltered sites for heroin users to use heroin? Are you convinced that needs to happen? How close is the city to doing it?
Yes, as you know, the mayor's task force put out its report last summer, and it recommended that the city explore whether a facility where drug users can administer drugs under supervision so they don't die of a drug overdose, whether that would be appropriate as part of the response. The city has been exploring that, is still exploring that. We don't have a decision yet. We hope to have a decision on that soon.
Have you been up to Vancouver, correct?
I have been up to Vancouver, yes, along with members of other departments.
Is it effective there?
In Vancouver, the facility there has saved lives. There's been studied.
Do you think that could happen here? Are you supportive of it?
Again, this is something which the city has been exploring. We're still exploring. The scientific evidence out there is it saves lives. Whether it's appropriate for Philadelphia is something we're not sure yet, and we hope to have a decision on that soon.